Hey, Eisenstein there, my friends. Dr. Allen here, and today we're going to be talking about Accutane and Retinol. Now, if you're new here to the channel, you may be wondering, wait, why is an eye doctor talking about this? Aren't these skincare products? Well, yes, and the reason we're talking about this is because they may cause a very nasty side effect to the eyes that could end up haunting you for the rest of your life. So first, what is Accutane? Accutane is an old brand name for a medication called isotretinoin. This is an oral systemic medication that is derived from vitamin A and is very powerful and usually prescribed to help treat severe forms of acne, but also off-label for other skin conditions. And unfortunately, like many medications on the market, we don't fully understand how it works, but we do know that it dramatically reduces both the size and the production of sebaceous oil glands, which are the primary oil gland of your skin. And with this, it makes sense why it is so effective at treating acne and why one of the more common side effects of taking isotretinoin is severely dry skin and even dry lips. Okay, so what's the danger then? How does this affect the eyes? Well, the issue is that within the eyelids, there's specialized oil glands called the meibomian glands. And these glands produce a little bit of oil that every time you blink, that oil mixes with your tear film and prevents your tears from evaporating into the air. And the problem is that Accutane or isotretinoin is known to shrink and damage these same oil glands to the point where not only does it cause a change in reduction to the quality and the quantity of the oil produced, but it can even cause atrophy and cell death to these same meibomian glands. And this side effect has honestly been known for a long time, but even in a recent publication, they did report almost a 20% loss of the meibomian glands in just use of 3 months of this medication. And when these oil glands don't produce well or they've died off, it can result in debilitating, horrible dry eye disease that can last the rest of people's lives. And what really sucks is that when these glands have died, there is no getting them back. We currently have no published evidence of medication or treatments to get these glands to grow back from death. So yeah, this side effect of isotretinoin is a pretty big deal when it comes to your eye health. Okay, so now knowing this, if you happen to be taking isotretinoin or Accutane right now, whether you have dry eye symptoms or not, I think it is wise to contact a local eye doctor or dry eye specialist if you have access to one so that they can image your glands and talk to you about the risks going forward, or if they have concerns or recommend different treatment options. Myself, I've had several patients put on this medication and we start to see significant dry eyes. It's affected their vision, their ability to wear contact lenses. And with that, I've reached out to my patient's dermatologist, talked to him about these issues, and talked about maybe switching them to an alternative medication. But ultimately, the decision to stop or change medications is something you need to discuss with your providers. Okay, now that we understand the risk of taking Accutane or isotretinoin, what about retinol? If you're not super familiar, retinol is an umbrella term used to describe the skincare ingredients and medications that are also derived from vitamin A. And this includes retinol esters, retinol, retinal, and tretinoin. And these are primarily found in ointments and creams that are applied to the skin to help treat things like acne, hyperpigmentation, as well as further anti-aging benefits. And these are found in a lot of products, and I mean a lot of products. And since these retinol ingredients are so similar to isotretinoin or Accutane, you can understand why eye care providers have this concern that there may be a negative effect when they're applied around the eyes. But what does the published science say? Does retinol cause dry eyes? Well, unfortunately, there just isn't much out there in terms of published clinical evidence really showing an association between the use of retinol creams and dry eyes or meibomian gland dysfunction. I spent a long time trying to dig up everything I could on the internet and in publications, just couldn't find anything. So currently I have to agree with Dr. Dre on her channel that there just isn't enough evidence to say that retinol creams cause dry eyes. But with that being said, there are published concerns and anecdotal reports from dry eye specialists who report that there is this connection between the use of retinol creams and dry eyes. And that's why a lot of eye doctors and some dermatologists do recommend trying to avoid putting retinol creams on the thin skin tissue of the eyelids. But again, there's just no published clinical evidence that I can find tying the two together. But I'd love to hear from you if you have ever used retinol creams around the eyelids. Have you ever developed problems with dry eyes? Yay or nay, yes, no? What has been your experience? Let me know in the comments. Okay, so what if you've used these products and you now have dry eye symptoms? What can you do about it? Number one, contact a local eye doctor, especially if you can find a dry eye specialist in your area. That way they can scan your oil glands and tell you how many you have left and how well they're producing. That way they can, again, give you better guided recommendations of what's going to be good for you. I know in our clinic we have access to OptiLight, or IPL, which stands for Intense Pulse Light. It's a therapy that has not only helped myself, but I know many of our patients, and it's been FDA approved here in the US for treatment of meibomian gland dysfunction. Another option is that of thermal pulsation. There's many different forms of this, but this is a procedure done in the clinic where they heat up the oil glands and express the oil that is trapped and inflamed in those glands to get that out and allow them to produce better oils again. If the oils are significantly trapped in those glands, and some doctors can also do meibomian gland probing, where they basically puncture those glands and get them to open up so they can actually get the oil out. More of a conservative treatment that you can do at home that we've talked a lot about on this channel before are doing warm compresses. Also potentially taking omega-3 supplements. I have done a video going more in depth about the debate and the science of omega-3s in regards to dry eye, as well as my own personal journey finding success with omega-3s, and I'll put a link to that video again in the description below if you want to check that out and learn more. And more recently, here in the United States where I practice, we now have access to a prescription medication called Mibo, which has been out in other countries for about a decade or so, but this medication is kind of like a synthetic version of the oils of your tear film, and you can put this eye drop on the eye for up to 4 times a day, and it sort of seals in the moisture and prevents those tears from evaporating, similar to what your oils naturally do in your eye. It's of course not a permanent cure, it doesn't fix the root issue, but I think it can be really helpful for a lot of people, especially if their oil glands have all gone away. If you do want to learn more about different causes of dry eye or different dry eye treatments and things available, I'll put a couple of links to some other video features here to the side. Otherwise, thank you so much for watching, and I hope this video really helped you out. Keep an eye on it, and we'll see you in that next video.